Hello, my name is Steve Collins. I'm a doctor of Chinese medicine. I've been practicing for about 6 or 7 years. I first became interested in Chinese medicine when I was about 13 years old, when I was a student of Chinese Kung Fu. In the study of Kung Fu, we learned not only about hurting, but healing as well. So I had a very rudimentary understanding of Chinese medicine. As I got older, when I ran into the president of the School of Chinese Medicine, we had a long talk, and I went home and did a lot of research, and I discovered that Chinese medicine is a real medical model. It is not a New Age kind of phenomena that comes and goes. Chinese medicine actually has a history of over 3,000 years. It is a very clinically relevant medicine, and its effects are very profound. It has a wonderful way of looking at the body, looking at health and healing, and it uses several tools to achieve healing within the body. One of these tools, one of these most powerful tools, is Chinese medical bodywork, Tuina. Today we're going to talk about Tuina. What is Tuina? Tuina means to push and to grab. It is one tool in the toolbox of Chinese medicine. Chinese medicine is known for most popularly acupuncture, but there are many techniques that we use and many treatments that we use, including Tuina, which is Chinese medical bodywork, cupping, gua sha, which is covered in a different video, dietary therapy, or pharmacology is herbal medicine. Now, Tuina is one tool, and Tuina is a very effective tool. Tuina is centuries old. It was first developed as something called Anmo by a very famous Chinese physician, Hua Tuo, centuries ago. And essentially it just simply began as a series of exercises, and it developed into a therapeutic technique. Now there are many different styles and techniques of Tuina. What you'll be seeing here today is something called dynamic Tuina. Tuina can be used very effectively, most commonly for musculoskeletal conditions, but it can also be used for conditions such as menstrual cramps, constipation, fevers, and it is the treatment of choice for pediatrics, for children. Now, Tuina is a very powerful type of treatment. So when you use it, you should recognize, again, it is not chiropractic. There are no rapid jerking motions. There is no work done on the spine, and it is much more profound than massage. Because it works on the bones and the joints, it is not uncommon to feel and hear pops and clicks as the patient's body realigns. Okay, we're going to start with the opening sequence. Remember, hold the patient's skull, the occiput, in your fingers. Okay? Maintain their head in a neutral position. Opening, you're going to put your thumbs under the mandibles, exert gentle traction for about 3 seconds, and release. And then we're going to move to the sides. First, moving the head and neck as a unit, being careful not to crink or crease. You want to move the head and neck as a unit to the sides. Okay, now for the sake of the camera, I'm readjusting. Okay, but in practice, I would be standing behind her head the entire time using good body mechanics. Turn it 45 degrees, flex, extend. To the other side, 45 degrees, flex, extend. As close to 90 degrees as you can get. Flex, extend. Flex, extend, and return to neutral. Okay, now we'll move to the shoulders. I'm going to grasp her hand right at the wrist, right below the wrist crease. And I'm going to pull continuously until her shoulder comes up off the table. Okay? So I'm going to go below the chest and above the chest. Okay. And then move to the other side. Same thing. Gentle pressure, shoulder to hip. Below the chest, above the chest. Now I'm going to open up her hips. Bend her knee, flex, release, flex. Plant her foot next to her knee and push over, roll over. Reposition her foot and roll. Now I'm going to place my hand right above her patella and lay her leg right on top of my hand. Press straight down and then press away from her head. Flex out. Support her leg and release. Same thing, other side. Everything is always repeated bilaterally, regardless of the complaint. Plant your foot on the other side. Roll. Place my hand above her patella. Straight down, away from the body, and place your foot down. Now, I'm going to open up her feet. Remember, the body's stress travels from the feet all the way up the long bones, all the way up along the spine. So it's not uncommon for patients who complain of low back pain, mid-back pain, neck pain, to have issues with their feet. So I'm going to open up her feet and then her hips again. I'm going to open her feet by kind of grabbing her ankle and twisting and pulling. There. And you'll feel pops and you might hear clicks. Right? Come to the other side. Same thing. Now, let's open up her hips. I'm going to flex her feet, okay, to relax her tendons and her ligaments. Grabbing her ankle and her foot, I'm going to pull along the straight line and release. Same thing. and release. Now I'll have her turn over. We're going to work on her shoulders. You always want her to turn her head away from you. So I'll ask her, turn your head. You're going to place her in what appears to be a hammerlock. You're going to slide up underneath and place your palm on her shoulder. Okay, on her scapula. The other hand comes up underneath and just supports her shoulder. And all you're doing is just opening up the shoulder. Very nice. Move her head back down. Find her scapula and then press gently. Now, remember, in Tuina, no work is done directly on the spine. So what I'm going to do is feel the spine with my fingers and then place my palm right off the spine between the spine and the scapula. And I'm going to press gently but firmly in a continuous motion. And this will release ribs that are out of place. It doesn't take much pressure. And the first time you do it, you'll be amazed. You'll feel that pop. There. Now, with her head still facing away from me, I'm going to cross the table and release her hip. Always tell your patient what you're about to do. I'm going to grab your hip, okay? Okay. So I'm just sliding my hand up underneath. I'm feeling her pelvis and just putting my hand under her pelvis. Some patients tend to tense up at this moment, so you just tell them simply relax and let their body fall. You take your other hand and place it not on their spine, but at the lower half of their ribs. Her ribs end right about here. So I'm placing my hands right above that, and I'm going to pull in a twisting and then a second motion, more of a pulling manner. 1, twist, and 2, pull. Alright, now at this point I'm going to release her hips again, but I'm going to use a wonderful technique. This is a technique that releases the piriformis muscle. And this muscle, because of its location, because of the nature of how it interacts with the pelvic girdle, many patients' complaints can be resolved with this technique alone. It's pretty amazing, pretty profound. The first thing I'm going to do is I'm going to check her leg length. So I'm going to do this by bringing her feet together and simply bending her knees. Okay, now, in some patients, in fact, many patients, the majority of patients, when you do this, now I want to bring her knees straight up, but in some patients, their one foot will be shorter than the other, noticeably so. So let's say, for the sake of this example, her left foot is shorter than her right. 9 times out of 10, that's a functional shortness, not an anatomical one. What that means is her hips are out of place, her legs aren't truly anatomically short. This leg isn't physically anatomically shorter than the other leg. It's just that because her hips are out of place, that's pulling on her legs and causing the shortening. So once you release that pressure, the legs should come back to normal. So to do that, I'm going to cross one foot over the other above the popliteal crease. Okay? I'm going to reach underneath supporting the knee, and then I'm going to bend my knees, and as I stand up, lift her hip at the same time. And I'm going to place my hand on her gluteus and press and work it. Okay, all the time maintaining this hip up. And at some point, you will feel a release. Do it on the other side. Typically, what I do is I start with the tall foot. That's the side I start with, and then I go to the short foot. And I tell my patients, when I move to the short side, I tell them, typically, this is going to be a little bit more tender. And then afterwards, their feet should be neutral. At this point, I'll have her turn face up. And I'll go through the closing sequence. The closing sequence is identical to the opening sequence, with the exception that there is no traction. So it is simply placing the head in the neutral position, moving the head and neck as a unit, coming back to neutral every time. 45. To and fro. 45. 2. Flex and extend. Back to neutral and back to 90. 1. 2. Take a deep breath in and out. On the exhale, a little bit more. 1. Exhale, big breath. And that's the basic sequence for dynamic Tuina. This is the opening and closing sequence for dynamic Tuina. Okay, I'm going to demonstrate an entire sequence going through the top to the bottom of the body, but you always begin and end with this. You want to grasp the patient's scalp underneath so that their skull, the back of their head, is resting on your fingers. Place your thumbs under the mandible and exert some slight traction, just for about 3 seconds and release. Now, you only do that in the opening. You do not place traction on the closing. And there are 2 reasons for doing this opening. One is to establish a baseline where the patient is, and the second is the process itself opens up the head and neck area, allowing greater flow of chi, blood, and partial ring alignment. So, the first thing you're going to do is maintain the patient's head in a neutral position. If her head is tilted forward, you're going to tilt it up. Okay? And then you're going to move the head and neck as one unit to each side. Now, as you do this, as a practitioner, you want to maintain good body mechanics. And you do that by staying in front of the head. In other words, you do not move the head without moving your body. So, the first movement is simply straight up and down to either side. Then turn the head about 45 degrees. Move flexion extension, always maintaining head and body. Move back to neutral every time. Go to the other side, 45 degrees, flexion, extension. Okay. And then as far to 90 degrees as the patient can tolerate. Flexion, extension, and you'll reach a point, if you're listening to her body, where you'll know where to stop. Come back to the center, return to midline, 90 degrees. Flexion, extension, return to the center. That is the opening and closing sequence. Now we're going to move to the shoulders. You're going to grasp the hand just below the wrist crease, so you have a good hold on the hand. Now I'm going to pull. Now I'm going to pull in a diagonal towards her hip, shoulder to opposite hip. Okay, and you'll see her shoulder come up. Now, it's not uncommon to feel cracks and pops in the wrist. Many people, their wrist bones are impacted, and this releases the hand. So it's not uncommon to feel those pops and cracks. So again, it's just a nice, gentle, continuous pull and release. Okay. And then we're going to come over and do the other side. Again, you'll see the shoulder right up and release. Okay. Now I'm going to move to the hips. I'm going to open up her hips by flexing and simply flexing up, return to center, open her hips, flex, and plant her foot. Rotate her hip, lift up her foot and place it on the other side of her knee. Her patella is right here. Okay, and her foot is just on the other side. I'm going to rotate, place my hand right above the patella, and lay her foot down. Gentle pressure, and then gentle pressure. Pressure down, and then pressure away from the body. And then close by opening up her hip again. Support it and place it gently down. Again. Flex. One motion. Turn to center. Open up. Turn the hip. Place the foot on the other side. Turn. Above the patella. Gentle pressure down. Gentle pressure away from the body, away from the head. Okay, and now let's move to the feet. Okay, all I'm going to do is essentially anchor her ankle and open up her foot using gentle pressure pulling out and twisting. And you can actually hear and feel pops and clicks. And then placing the thumb on right below the ball of the foot. A little bit of gentle pressure on the great toe. There. Pulling. There. Okay. Come over to the other foot. There we go. Feel it? Okay. Now, typically when this is done, I stand on the outside. So for the purposes of the camera, on her left foot, I was on the inside. But in practice, I would be on the other side. Okay, open up her foot. And now at this point, what I'm going to do is open up her hips by pulling on her feet. Okay, so what you need to do is loosen up the ankle. Okay, so all you're going to do is flex it a bit, just like this. And you'll feel it loosen up. When it's loose, you want to hold the foot at about a 90-degree angle. Again, anchor the heel, grab the foot right below the ankle, thumb on the bottom of the foot on the plantar aspect. And you're going to pull straight and release. Okay? Again, same thing. Release. Thumb on the plantar aspect. Cup the ankle or cup the heel. And pull. Right along the lines. It's not uncommon to get really profound pops, especially the hip. At this point, I'm going to have her turn face down. Okay, at this point, I'm returning back to her shoulders and upper back. You want the patient with their head turned away from you at this point. So, I'm going to open up her shoulders. I'm going to bring her arm back and put her in what appears to be a hammerlock. Okay, slip my arm up from underneath and place it on the scapula. My other hand goes underneath her shoulder, just supports her shoulder. All I'm doing is just lifting and rotating, using some gentle pulling and opening up her shoulder. There. And then place your arm back. Place your hands on the scapula and rotate. Now, in Tuina, no work is done directly on the spine. So what I'm going to do next is I'm going to locate the spine with my fingers so I know where not to be. Between the spine and the scapula, I'm going to put my palm. And I'm going to very gently, in a continuous motion, push and release. And I'm going to work up and down. Just like that. Okay? And what that does is, sometimes if there's a rib that's out of place, this will put it back. Patients will complain of a very specific kind of pain. They'll say it's a very sharp pain, and they'll be able to say it's right here. Okay? You do this, it pops, boom, pain's gone. All right, now I've just done the same thing on her right side as I've done on her left. So what I'm going to do is I'm going to tell her, I'm going to grab your hip, okay? Always tell them what you're going to do. Place your fingers under until you feel the hip. You'll feel the pelvis and just put your hand right there. Okay, tell them to just let go and relax. You're going to place your other hand on their lower rib cage. Now her ribs end about here. So I'm going to go right about here, not on the spine, right off the spine for support. And all I'm doing is I'm going to twist. And then I'm going to do the same motion. The first one is like this, the second is more like this. So the first one is more like this, and the second is like that. Okay. Okay, the next thing we're going to do is release her hips again. This is specifically a release for the piriformis muscles, and a great many problems can be resolved just by simply doing this one technique. But typically the first thing that you want to do is check foot length or leg length, and bring the feet together and up, and they should be pretty even. Now, it's not uncommon to have patients where their feet are uneven. Okay, and typically 9 times out of 10, that is a functional imbalance, not an anatomical one. What that means is their feet aren't physically uneven. They're uneven because their hips, instead of being balanced, are tilted and sometimes skewed. So by releasing that and getting them back in balance, the feet that present like this when you first do it will come together and become even when you're finished. Now, to do a piriformis release, bend the leg and pull the knee out. Okay, place the foot on the opposite leg. Take your hand, grasp the knee. Now, I strongly recommend bend the knees and then come up. You're going to lift the knee off the table. That gives the proper angle for this. You're going to place your palm right in the buttocks area, and you're going to press, and you'll feel it. Release. There. Okay. Often it's a fairly subtle release. Sometimes patients can feel it, especially if they have a significant difference in their feet when you get that release. Typically, I always start with the side that's higher first and then move to the lower side. When I move to the lower side, I always tell them you're probably going to be more tender on this side, and that is a piriformis release. At this point, I will have her turn face up. So remember, in the closing sequence, you do not pull, but this is where you might experience, if you're going to get pops and clicks, you'll get them in this sequence here. Okay, so again, it's to the side, and you can see that there's a far greater range of motion than when I first began. Now, sometimes you might reach a point where you think the patient can move more, but they're a little locked up. All you do is say, take a breath in and out. On the exhale, move. Back to neutral. $90. Again, if they reach a point where you feel they can flex more, especially on the 90, have them drop their shoulders, move their shoulders to the feet. That gives you more room. And breathe. There. That's the sequence. All right, let's talk about patients with shoulder complaints. Now, the shoulder is a pretty complicated joint. It's a ball and socket. It's the largest single joint above the hips, with the exception of the neck. And the shoulder has many muscles which attach to it and affect its movement. So there can be many issues with shoulders, anything from what's called a frozen shoulder to a rotator cuff injury to injuries with the bones, injuries with the ligaments or the tendons or the muscles themselves. So you really have to be careful with joint injuries. But assuming that the patient has been cleared and has no fractures or dislocations, you should be safe when using dynamic Tuina. So again, we're going to open the shoulder using the technique of pulling across, and that's from shoulder to hip at the 45. And notice that her shoulder will come up off the ground, come up above the chest, and off the ground. Now, another way that you can get more lift is to simply hook up underneath, kind of elbow to elbow, let her wrist drop, and then I'm going to lift up, and that gives me more extension. What you're trying to do is open up the joint here. Okay, and that again will allow for the free flow of qi and blood, and allow for realignment of the musculature, and will allow for a healing. So once you've opened up her shoulder here like this, other techniques that you can do are, another technique is to grab the wrist, just like before, and pull along the straight line of the body here. Okay, and then come out to the 45 and pull there. And then have her turn face down. For the sake of the camera, I will continue working on this side. Everything you do, regardless, should be bilateral. So I'm often asked, do you work on the affected side, the injured side first, or the uninjured side? Well, typically you would want to go to the uninjured side first and work that side, unless the patient is in acute pain and you feel that you can relieve it using these techniques. And then obviously put out the fire. All right, so if I'm working on this side, I'm going to have her turn her head away from me. Again, use the hammerlock technique to open up the shoulder. Put my hands on her scapula and rotate and press. Find the scapula, find the scapular spine. I'm actually inside the scapula, resting on the back of the scapula. I'm pressing, just gentle pressure. Now, I'm going to find the top of the scapula and the space between the top of the scapula and the base of the neck right here. Find it with my thumb and with some gentle pressure. Press, you'll feel a knot. And press and just kind of work it. And you'll feel a release. If you need more, mark that spot, take your elbow, place it Bring your arm forward. Have the patient breathe in and out, and on the exhale, press. There. Very nice release. Do you feel it?
Mm-hmm.
Okay. So we're working on the posterior shoulder here, which is where many patients experience problems. If they have problems in the joint itself, in this area, that's a whole different area to work on, obviously, than the posterior shoulder. So for this, there are a couple of ways to go after this. One is with the pulling motions. Another is to find kind of a hole or a depression right in that area and simply work it. There. You feel that?
Mm-hmm.
Okay. Right there. Again, mark it with the elbow. Be very careful here. In and out. And that can release this area. If I'm working on her left shoulder, what I'm going to do is come around up underneath, take her hand and place it over my right hand. My left hand is going to come back onto her shoulder. I'm going to grab her arm and just simply turn. And then downward pressure, like that. Again, repeat it on the other side. Up underneath, elbow, shoulder, there. And that is shoulder work. Tuina can also be used for such things as menstrual cramps and low back pain. For menstrual cramps, it's very simple. There's an area, there are a couple of points in the lower spine that are very, very reactive to menstrual cramps. And there are a couple of ways of addressing this. One is directly through Tuina, which I'll show you in a moment. Another way is to have the patient lay on a tennis ball, for example, face up with a tennis ball in this area and just kind of roll on it. And amazingly, that kind of thing relieves menstrual cramps. But to use Tuina, in addition to the hip pull, this thing, you can also find a spot. You find the sacrum, and on each side, elbow, come a little bit forward, and then deep, constant pressure. Like that. For about 30 seconds each side, and that goes a long way towards resolving menstrual cramps. Many patients experience relief. Now, other techniques specific for low back, there's a wonderful technique. Bend the hip or bend the foot, bring her knee up under my hand, and her foot is resting against my side. Okay? This is also a type of release for the piriformis and the hips. So I'm going to place my hand on her posterior pelvis, lift up, and pull back. Up. Very nice release. And finally, simply moving her pelvis manually like that. For constipation, you can do a manual kind of massage for the abdomen, which should produce results within a few hours. And very simply what you're doing is you're starting, and I typically start in the upper quadrants and work my way down. Using my fingers, the flat of my hand, I'm going to get in there and manually massage. Okay. Come over. Now, my left hand is right at her ribs, right below her ribs. Okay, get in there, manually and gently massage. But let me take my hand away so the camera can see. I'm pressing fairly deep. The secret to this, to maintain patient comfort, is to go slow. If I just jammed in there, went in there, she would come flying off the table. And I can do this in the most sensitive areas, the belly area, as long as I go fairly flat, fairly slow, and maintain a constant motion. And that massage can help relieve constipation. For carpal tunnel patients, usually the treatment of choice is a combination of acupuncture along with Tuina. When I get to the Tuina, typically patients complain of a very specific pain in this area of the wrist. Okay? So what I'm going to do is aimed at relieving this pressure. The pain is caused by pressure. Carpal tunnel is one of what is called a compartment syndrome. So by relieving the compartment here, that can relieve the pain. So you do this by flexing and pulling the wrist, giving it a little bit of traction, and then working on the saddle joint of the thumb. The saddle joint of the thumb is this joint here. Okay? It is the only joint of its kind in the body. It's unique. But what I'm going to do is manipulate it. And pull. I'm flexing and pulling. Opening up the thumb. After that, I can just release the fingers. Do a little bit of work on the hand. And release the wrist some more. And that is very useful in the treatment of carpal tunnel. Plantar fasciitis is an inflammation of the fascia, which is the tissue, the sheath surrounding the muscle on the plantar aspect or the bottom aspect of the foot. That's why it's called plantar fasciitis. You can relieve it using techniques of Tuina. Usually, patients complain of pain right along this tendon area right here. And if you press here, they will practically come flying off the table. So essentially what you want to do is kind of release that. What's happened is the fascia, that sheath surrounding the muscle, has become inflamed and it's tightened up. So you begin by opening up the foot Okay, open up the foot. Gentle pressure on the ball of the foot here, the great toe, pulling along the body's lines. And then using that pressure to kind of twist up and twist down, up and down. And then I like to run either my thumb or this part of my palm right along the instep. Again, working this part of the foot. And eventually you'll feel it start to release. And the patient will tell you, always use the patient as your guide. That's how you treat plantar fasciitis. Very simple. Okay, this is a technique for releasing the low back area from about mid-spine on down. Okay, it's a very nice technique, but you have to use good body mechanics. Go ahead and spin around, please. So you're going to position the patient on the side of the table. I happen to have one leg up on the table. And I'm going to reach underneath her arm, take her other elbow. My other hand is going to come underneath that elbow, so I have her far arm in my grasp. I'm going to have her rest against me, just kind of lean against me. And all I'm going to do is, as I lean back, I'm going to lift up. And I'm going to go underneath her armpit too for some support. There we go. And that's it. So we're coming off the oblique on this, and that releases quite a bit of tension. Just spin around on this. And that releases quite a bit of tension actually on the opposite side, the spine. So I will do this on both sides. And spin back. So I've done her right side. I'm going to come over, put my leg up, come up underneath, grab her elbow, have her lean against me, and notice that I place my head on the far side. Come back, and there. There was her shoulder. There's a nice release there. And that's a wonderful technique for the spine. And sometimes you'll get some releases up above too, which is always a good thing. With some patients, their necks might present more of a problem. You might have more of a difficult time releasing this area, the cervical area. So in addition to this opening motion, what you can do is come over to about the 45, turn, and extend. Okay, this is a very nice, gentle technique. You can do it on the opposite side as well. 45, turn, and extend. Okay. So, with a complaint of pain in the bottom region of the ulnar area here, what you can do is work on the ulnar and radius together by pulling a little bit of rotation. Oftentimes, if a bone is jammed, most of the time it's the radius. Sometimes it's the ulna. If it's the ulna, it's more difficult because it's the smaller bone, so it tends to hide. but you can release it. There. A little bit of tension, pulling, allows the bones to realign. Feel that?
Yeah.
There.
Mm-hmm.
Okay. So, in conclusion, there are several things to remember when you're doing Tuina. First of all, as healers, you should never, ever be afraid to place your hands on a patient, as long as you place your hands on a patient with respect. And people can tell, they know when you touch them with the intention to heal or with other intentions. Second, you must learn to cultivate the ability to listen to a patient's body with your hands. These are the most powerful tools that you have as a healer, whether you are a massage therapist, a physical therapist, a doctor of Chinese medicine, a chiropractor, or any type of healer. Your hands are the single most powerful tool that you have when assessing and treating patients. So don't ever be afraid to, one, use your hands on a patient, and two, cultivate the ability to listen to a patient's body with your hands. Tuina, dynamic Tuina, is a very powerful set of techniques that can be used to help heal a body and to help realign a body. It can relieve pain very quickly, very rapidly, and can have amazing results. When you relieve a patient's pain, they will return. Using these techniques responsibly is one of the most profound and powerful tools that you can use, that you can do as a healer in your practice. So I encourage you to study these techniques and to learn them, and to contact me if you have any questions.